With that, I would like to introduce our next speaker. It's Sophie Badzgaradze from Georgia. Dr. Badzgaradze is a specialist in oncology and hematology with more than 20 years of clinical experience. She serves as a clinical director of the Integra Center and works as a medical specialist in several clinics in Georgia. She's an active member of international professional societies, including the ESMO and the ESCO, and she regularly contributes to international scientific meetings. With her presentation today, we are also launching a new series within this educational format. In future meetings, we hope to highlight perspectives from different European countries, sharing insights in the development, awareness, and clinical practice of integrative oncology across Europe. Today, Dr. Badzgaradze will open this series with presenting the landscape of integrative oncology in Georgia. So please join me in welcoming Sophie Badzgaradze.
Hi, my dear colleagues. I am from Georgia, medical oncologist Sophie Badzgaradze. And first of all, I would like apologies for not being able to attend in person today and present in front of you. Due to the current global situation in Caucasus region. So it's a great pleasure for me to be here and to take part in his international congress alongside such respected colleagues, including Mr. Hubenthal and all of you present. Let me now move on my presentation today. I will be discussing the instruction of Haeckel 3000 device in Georgia, as well as the experimental and clinical studies in our country. This innovation device was introduced in March 2023 and for the first time in history became available not only in Georgia, but in entire South Caucasus region. We are proud to be among the first specialists working for this device technology as a support tool in clinical oncology. It has already demonstrated very encouraging result, and we have a lot of successful clinical cases when we use together hyperthermia and chemotherapy in different oncological diagnosis patients. But we have only 2 hours experience to use in this machine in our clinic. And today we present these clinical cases. Now would like to present on our clinical breast cancer patients was diagnosed with invasive carcinoma with lung metastasis in stage 3. Regarding the tumor biology, the patients showed positive hormone response status with high experience of both estrogen and progesterone receptor, while HER2 was negative. The key 67 proliferation index was relatively low and around 10%. The patients underwent new additive chemotherapy using AC courses chemotherapy, and we use this treatment method together with combined 2 cycles hyperthermia with Haeckel 3000, followed by paclitaxel 3 cycles weekly, and nowadays we have clinical remission after surgery. This patient use only radiation therapy, only therapy with bones and combination with hormone. And nowadays this patient after treat 1 year, so we have clinical remission nowadays. Is breast cancer. Patients with bladder cancer. But today we present only 1 patient's clinical cases, but we have 7 patients with blood cancer when we use only hyperthermia, and we use immunotherapy Tecentriq in these patients, and 2 patients we use radiation therapy. And in my opinion, really, we have a good result and successful result in blood cancer. And this patient we treated in 2027, and we use only for 4 cycles with hyperthermia and 4 course with Tecentriq, and we nowadays in this patient has a good result. 2 years we don't have they made checkup only every 3 months, and we in this patient has a clinical remission too. And clinical case, the case with ovarian cancer. In Georgia, we don't have this treatment method about ovarian cancer, HIPEC, and we have a small treatment method in Georgia. And these clinical cases, when we use hyperthermia together with chemotherapy, really it's for our patients is good, and it's helped us to take clinical remission in this page, because in ovarian cancers we in Georgia don't have a to screening center. And our patient come clinic when they have 3 or 4 study, and it's really very stage, and really it's very difficult to treat it. And to treatment method we have only chemotherapy and radiation therapy, not a different treatment. And when we take and we take this machine in our clinic, we help this patient to take clinical remission. It's the third study and for stage 2. So these patients are diagnosed with ovarian cancer. Initially, these patients underwent neoadjuvant chemotherapy followed by surgery treatment and adjuvant chemotherapy. However, in 2024, this disease is relapsed and presented in a more advanced form. The patients developed peritoneal carcinomas, is recurrent ovarian mass, is a pelvic cavity with invasion into the sigmoid colon, as well as the metastasis to the liver, multi-type lymph nodes, and the stage the device was classified stage 4. For the treatment of the recurrence, we aim the combined both. The patient receives 2 cycles of hyperthermia using the Haeckel 3000 device together with 2 cycles of only chemotherapy with gemcitabine and cisplatin following the treatment. Then we made underwent surgery, including liver resection, and we were able to achieve resolution of the metastatic links. And nowadays, we in this patient has a clinical remission too. And in gastric cancer, this patient came is our clinic because the surgery cannot use discuss about surgery, and we began because he has a metastasis is a nearest liver, and this patient we discussed treatment method about to use Haeckel 3000 with chemotherapy. And these patients, after 2 courses with hyperthermia together with chemotherapy, after checkup with surgery, they discuss to treat it and use surgery in these patients. After surgery, we treated only 4 courses in this patient, chemotherapy, and 2 courses with hyperthermia, gemcitabine with oxaliplatin. And nowadays, this patient has a good result too. Now we really based on our observation and clinical experience over the past 2.5 years, as well as practical clinic studies using the Heckel 3000 device. We have seen the combined hyperthermia and chemotherapy prove the best result. When used during neoadjuvant chemotherapy and following the planned treatment of 6 and 8 cycles, we have found the recurrence of seasons can be reduced, and significant effects that already observed after just 2 or 3 cycles when hyperthermia is out, and everyone we know about hyperthermia chemotherapy toxicity in patients, and in my opinion, really, it was very, very good to came in Caucasus region this method treatment, and I say thanks my lovely doctors Hubenthal and my lovely colleagues Heckel too, who helped us to take this machine in Georgia too, and we helped our oncological patients in Caucasus region to take clinical remission in 3 or 4 stages. Thank you. If you have questions, I ask you.
Thank you very much, Sophia. Yeah, are there any questions from the audience from here to Georgia?
Yes.
So I maybe can start with another question. How would you describe the current level of integrative oncology when it comes to the awareness or acceptance in Georgia, both among the healthcare professionals and the patients?
We use, you are interested to have the integrative treatment method in Georgia. Really, nowadays we don't have integrative oncology. Only our clinic use integrative fields of method in oncological patients, because my colleagues in Georgia said and use only in European protocols and use only really chemotherapy and radiation therapy.
Okay, thank you. Are there any other questions?
You don't have questions?
No, it's good. Thank you so much.
Thank you.
Have a nice evening and all the best for you.